Hello, I'm Dr. Richard Harris, and I'm one of the clinical advisors and board members of Life and Breath Foundation. And I just want to do this quick video for a question we got from a sarcoidosis patient, and that was about iron infusions and possibly worsening sarcoidosis. Now, this is a very complicated question because first of all, you really need to be sure that you have an iron deficiency, working with your physician, whether that's your rheumatologist, your primary care physician, or a hematologist, about being accurate with the diagnosis of iron deficiency. We know that inflammatory conditions can cause what looks like an iron deficiency, but it may not actually be an iron deficiency. So there's some lab work that you can do to figure this out. Now, can iron infusions exacerbate or worsen sarcoidosis? It is possible. In my literature review, I couldn't find any studies on this. Certain types of iron, especially like iron dextran compared to iron sucrose, iron dextran tends to cause more infusion reactions. These are immune reactions, and we usually give a test dose for that and then the infusion, whereas iron sucrose, we don't typically give a test dose for that. Now, in a situation like this, a physician may do a smaller dose in a person who has sarcoid, who maybe has had infusion type reactions before, or they may not do iron infusions and maybe they do oral iron. So I can't conclusively say, hey, oral or IV iron is bad for all patients with sarcoid, or IV iron is good for all patients with sarcoid. You really have to take this and individualize your approach, because these moieties, iron given by infusion, has been associated with immune system reactions, what we call infusion reactions, allergic reactions. And so these are things that could possibly cause a sarcoid flare. But that's why you really need to work with your physicians and come up with a plan that works for you, which may involve a test dose or lower doses of oral iron, or maybe trying some oral iron before IV iron. There's multiple different strategies, maybe using some pre-medication strategy that we do for some infusions to help reduce the risk of an immune system reaction. So this all really needs to be individualized between you and your physician.